Our clinic at UW-Madison is special because we treat every patient as an individual. I am Dr. Rachel Wynot, and I work for UW-Madison's Reproductive Endocrinology and Infertility program. The specialty of reproductive endocrinology and infertility is a subspecialty of obstetrics and gynecology. So we have been trained as OBGYNs, but then did additional training to specialize in this area of medicine to help people build their families, become pregnant, and then also take care of other related conditions that could potentially interfere with fertility at some point in their lives. Our clinic is proud to serve a wide range of patients. We do not have a BMI cutoff for our IVF program. We will use patients' own eggs up to age 46, and we will offer embryo transfers in healthy individuals up to age 55 per ASRM guidelines. We want our patients to know that at UW-Madison, we're here for you. We are here for you through every step of your journey, through helping you get pregnant, helping you with whatever condition that you may have. Once you are pregnant, our colleagues in the OBGYN department or the high-risk obstetrics are happy to give you that continuity of care between your providers and that we're all partners.